Welcome to this video on shock and anaphylaxis. Our focus is the recognition of hypoperfusion and rapid escalation of care. Shock is a critical medical emergency where the body's tissues receive inadequate oxygen delivery. We must recognize early signs before a patient deteriorates. Our learning objectives are to define perfusion and hypoperfusion, recognize compensated and decompensated shock, differentiate major shock categories, and describe critical first aid priorities while activating EMS. Early recognition and immediate action are key for managing shock.
Perfusion relies on the perfusion triangle: the pump, the pipes, and the fluid. Failure in any one area leads to shock. The pump is heart function, the pipes are vessel tone and integrity, and the fluid is blood volume. This model helps connect the underlying cause to patient assessment findings.
In compensated shock, the body attempts to maintain blood pressure. Early signs include anxiety, restlessness, rapid heart rate, and rapid breathing. Cool, pale, clammy skin, and weak peripheral pulses are also key indicators. Remember, waiting for low blood pressure means we've waited too long. In sports medicine, common causes include hypovolemic shock from bleeding or dehydration, and distributive shock, often from anaphylaxis. Cardiogenic or obstructive causes, such as chest trauma or underlying heart conditions, are also critical to consider. Recognize the symptoms and escalate care immediately. First aid priorities for shock involve activating EMS immediately. Position the patient supine if tolerated. Control external bleeding or manage exposure. Continuously monitor their breathing, pulse, and mental status. Finally, provide a clear handoff of information to EMS. Anaphylaxis is a rapidly progressing form of distributive shock. Suspect it with rapid onset of symptoms after exposure, affecting the airway, breathing, circulation, skin, or GI tract. Do not delay using an epinephrine autoinjector if anaphylaxis is suspected and protocols allow. Always activate EMS due to the risk of progression or recurrence. Consider this case. An athlete is pale, sweaty, anxious, and dizzy after abdominal trauma, with a rapid pulse and worsening pain. These signs suggest compensated shock due to internal hypovolemia. You must activate EMS immediately. Position the athlete, and monitor trends for handoff. Our clinical takeaways are: shock is poor perfusion, not just low blood pressure. Tachycardia is an early clue. Treat causes within your scope, such as controlling bleeding. And remember, anaphylaxis requires rapid epinephrine and EMS activation. Thank you for reviewing this educational video. All emergency care concepts must be paired with hands-on skills training, local protocols, and current certification standards. This video was created using updated guidelines for first aid and emergency care.